On today's The Doctor Is In, the topic osteoporosis. It's called the silent disease. It is a common bone disease in which bones become thinner and more porous. Dr. Scott Ackerman, one of the First Coast's leading doctors, is here today to talk about osteoporosis and its effects on both men and women. Thanks for being here, Dr. Ackerman. We appreciate you as always. Let's talk about osteoporosis. And a lot of people would associate that and know that is bone loss. But how do our bones, I guess I should say, lose mass? How does that happen?
Well, our bones are made up of really two components. First of all, you need to understand that bone is a living tissue, like our skin or like other organs. It's constantly being absorbed and replaced. And in our bones, we have collagen, and they are the framework or the skeleton in the bones. And then on top of that is calcium phosphate, and that hardens the bone, and that gives us our strength. So the collagen really doesn't give us strength, but it's the calcium that we have to make nice, strong bones. And in our lives, our bones are strongest when we're younger. When we're active in our 20s and 30s really is the peak of our bone strength. But after we reach our 20s and 30s, our bones start to lose density as we age. We really can't help that. What we can try to prevent is losing too much density. We want to try to maintain a good, strong density in our bones. But as our bones lose density, that's when we get a situation called osteoporosis. And osteoporosis is the situation when the creation of new bone or new calcium strength in the bone doesn't keep up with the removal of calcium. And when you have osteoporosis and you lose bone strength, it increases, there's lots of diseases associated with that, lots of problems, but mainly it increases our chance of having a bone fracture.
And I think a lot of people would associate osteoporosis with women. You don't really hear it talked a lot about men, but it affects both men and women.
Right, right. We talk about it with women a lot. It's certainly more of an issue in women because women start out with bones that are not as strong as men's bones, but both men and women can have osteoporosis. Women account for about 80% of the osteoporosis cases. So men are the minority, but it's not, it's a significant number of men have osteoporosis. Caucasian and Asians, both men and women, are at highest risk. 20% of men over the age of 50 will develop some sort of osteoporosis-related fracture. So more than that have osteoporosis, but about 20% of them will have a fracture. So the risk factors are, as I said, Caucasian, Asian, age, being over 50. But other risk factors include things like smoking. Smoking increases your risk for osteoporosis. If you lead a sedentary lifestyle, so lack of exercise, believe it or not, causes creation of hormone production, growth hormone, those sort of things which help build bones as well. So I talk to a lot of the women who I see in my practice about, we talk about osteoporosis as well as cancer, and one of the things I tell a lot of these women is to do weight work instead of running, because that building muscle will help create hormones that will prevent osteoporosis. But also not getting enough calcium in your diet or vitamin D, because remember the two go hand in hand. We talked about vitamin D in the past. So you have to not just take calcium in, but also get sun exposure to have the calcium be absorbed and be incorporated into the bony matrix of your bones.
So what should we be looking out for as far as symptoms are concerned if we have osteoporosis?
Unfortunately, there's no symptoms when you have it early. So what we typically do is we do screening for women over the age of 50 periodically, which we'll talk about in a little bit. But so early on, there's no symptoms. But once you do have symptoms, once it's fairly severe, the symptoms include things like back pain. It gets progressively worse. Loss of height over time. That's why you see a lot of women, little short old ladies, that's because their bones in their vertebrae each have little fractures. Then they lose their height, and each vertebrae loses a little bit, so the whole spine is a little bit shorter, and women get shorter over time. Men too, but not to the same extent women do. Also stooped posture, the whole humpback thing, that's related to osteoporosis. And bone fractures. So these are all symptoms. Also bone fractures. If you get a bone fracture that occurred easier than expected, you were stepping out of the shower or going down a step and you put your foot a little funny, that could be related to osteoporosis. We hear about a lot of women who get hip fractures. And how'd you do it, Grandma? Well, I just, I don't know. I stepped off the curb, and before I knew it, it broke. Sometimes I think they fell and it broke, but sometimes it breaks and then they fall.
Well, since there are no real symptoms, that you can really tell you before you know that you definitively have it, is there any screening that you can get to determine if you have osteoporosis?
Yes, there is. And there's a special bone density scan, and we do it a lot of times in conjunction with a mammogram. Since we recommend mammograms every year, when you're going in for your mammogram, you can have the bone density study done as well. Not every year necessarily, but depending how you are, but that's a good time to get it done doing your annual mammogram and possibly bone density. So the bone density scan is called a DEXA scan, D-E-X-A. And DEXA stands for dual energy X-ray absorption, basically, so DEXA scan. So it's a very low dose of X-ray, like a chest X-ray, which is low dose. This is like 1/10 of that. Very low dose X-ray of the hip and the spine. Some people say but we do both the hip joint and the lower back to measure the bone density. And then we get a T-score. And the T-score tells us basically how many standard deviation units you are either above or below normal bone density. And that is, normal bone density is defined as a healthy 30-year-old. So they've done lots of 30-year-olds and they found what their bone density is, and your score is either above or below that. And so the normal scores would be one above or below, one standard deviation unit above or below that. Once you get more than that, then you become, then you have osteoporosis and osteoporosis if it's more severe. And so I recommend that all postmenopausal women be screened on a regular basis. And that means every 2 or 3 years, assuming their test is normal. If they're abnormal, if they have osteopenia, which is a precursor to osteoporosis, they may want to get screened a little more often.
And we have about 30 seconds left, but I just want to make sure, because I'm sure a lot of people have this question out there, is can you then reverse osteoporosis if you find out that you have it?
Yeah, well, sadly, you can't reverse it, but you could slow it down. And there's lots of ways to slow it down. Different vitamins, different there's medications as well. There's exercise, use a diet high in calcium. If it's really severe, there's some great new medications that will, that the endocrinologists and some of the gynecologists, but mainly endocrinologists I use for my patients, that'll help build up bones.
All right. Thank you, Dr. Ackerman. We appreciate you being here, and we also thank you so much for sponsoring this segment. And for questions regarding today's topic or any other health questions that you might have, connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.